Dr. Anand, welcome to the show.
Thank you for having me on.
We're going to start with some quick fire questions. So short answers, just whatever comes into mind.
Good luck.
Is there an average male penis size?
Yes, 5.1 inches.
Very quick answer.
13.2 centimeters if you're metric.
Is it possible to increase how long you last in bed?
Yes, you can train yourself. However, if you've got primary premature ejaculation, it's more difficult because you're almost programmed to do it that way.
Does cycling negatively affect male sexual function?
Yes, because it's like a punch in your taint. It basically compresses the nerve, and so it can reduce your fertility and it can reduce your ability to feel your penis. It's not great.
How often should you be having sex per week as you age?
That can vary. I mean, lots of studies say, well, it's about 3 times a week, in your 30s, twice in your 40s, and once in your 50s. But actually, people think you would genuinely have less sex than that. So there's lots of stable couples that are having sex less than once a week, maybe once a month. It doesn't really matter if you're not bothered about it, but libido mismatch is definitely a thing within couples.
Do penises get smaller or less functional without regular stimulation?
Absolutely. It's use it or lose it.
Can masturbation actually prevent or reduce prostate cancer?
Yes, we love a wank. So 21 times a month is the key number. Well, it doesn't have to be a wank. You can do solo sex or partner sex, or however many partner sex.
Can erectile dysfunction be fixed or reversed as you age?
It can get better, or you can reduce the rate at which it gets worse. It's not likely if you've got a really dysfunctional cause, such as like a physical cause, that it's going to get that much better. Does that make sense?
Yeah. Let's go into some of the detail now. We talk about penis size a lot, and that's because a lot of guys are just obsessed with the topic. Why do you think men are so concerned or anxious about their appendage?
Because men like measuring everything.
What, that simple?
No. I mean, partly it's that simple. We do like a stat, right? But mainly it's because we watch a lot of porn these days. If you think about before the internet, how many willies would you actually see in your life? I mean, unless you were a sort of male sex worker or a female sex worker, you're not going to come across that many. You might have seen people in the shower. You might have seen some of your family members, but that's about it, right? So now what we're doing is we're seeing porn, and where the average penis is 8 inches long. So that's kind of giving people a complex, and they're kind of expecting their penis to be that size. And when they don't measure up, they get really embarrassed and really focused on it. I mean, most of the people that I see that have got concerns about the penis actually have a completely normal penis size, but it's compared to what they're watching. And it's also sometimes partners may mention something, and it may be misinterpreted, that it might be that the sex wasn't very good and they blame the size of their penis. But like, if you're thinking the average penis is like 5.1 inches, the average length of a vagina, so let's go with centimeters, I can do it better than centimeters, 13.2 centimeters. The average length of unaroused vagina is 8 centimeters. So once that gets aroused, it opens up, the womb moves up, so it gives a bit more space, and then you can get tenting. So basically you get an extension of the length of the vagina to maybe 13 centimeters, which kind of feels like a pretty decent fit. 13.2 centimeters of willy, 13 centimeters of vagina. Maybe it was evolved that way. It probably did. If you've got something that's 25 centimeters long, it's kind of punching you in the ribs. So it may not be that comfortable.
Do you see a lot of men saying, can I do something to increase my penis size?
Not so much these days, actually. There was a lot more maybe about 15 years ago, actually, when I was younger, that definitely got more people coming in going, this is a worry for me. I think as people get older, they become more comfortable with their bodies, or they just don't care as much because they've probably had a few partners. They've realized that it doesn't actually necessarily matter to their partners so much. But there are some people who are very, very fixed on it. And there are some unscrupulous companies that want to take advantage of that. So they're trying to sell you potions and lotions and stuff just to make your willy larger. And you're kind of like, look, this isn't, I've got hands, not wands. I'm not a handsy Potter.
Hands, not wands. But there's nothing you can do to increase your penile length, is there?
No, you can kind of improve the quality of your erection. So part of that's arousal. So the more turned on you are, the more information going down to your genitals in a nerve sense, and then also more blood vessel opening. So basically your hard on gets a bit harder, and therefore it looks a bit bigger and it feels a bit more stonking for you, which is always pleasing. Always got to remember that obviously if there's 5 and a bit inches outside of you, there's another 3 inside of you, because actually it sort of sits slung underneath the taint, just above your balls. And that means you do have an 8-inch penis. It's just quite a lot of it's inside you.
Yeah.
So it's just about kind of accepting that's what your norm is. So you can't actually increase it like that, but you can cut the moorings. So for men who've got a very small penis, so a micro penis, what can happen is that just to get a bit more visible lengths, you look like you're a bit more of a shower. There's moorings at the bottom of your penis, like 2 ligaments that kind of attach to your penis at the base. And if you cut them, the penis kind of falls forward a bit. So it looks like it's come out a bit. However, when it's erect, it won't necessarily be much longer than it was before. I mean, it might be a centimetre or so bigger, but it tends to also clock downwards because the ligament that was holding it up to give you a hard-on has gone. So it kind of points downwards. So it can be a little bit less visually exciting for the person.
I mean, I see a lot of men still who believe they have low testosterone because they think their penises should be bigger. Therefore, it must be testosterone related. If I had more T, my penis would be bigger. I would be more manly in that sense.
Interesting.
And that's a relatively common thing.
I must say, very people say, but it's really interesting how different like client groups.
Yeah. But again, with your point, there's nothing you can do about this. These guys have gone through puberty normally, and I guess more T doesn't equal that result. I think the interesting part is the idea that men think they want a larger penis, whereas in reality, of course, it has no practical benefit, really.
No, I mean, I can completely get that. Like, for the visuals of pornography are really, they really sell it, don't they? Like, you know, if you've got a massive donger that's kind of swinging into view like a crane, then it kind of looks a lot more visually impressive than if someone has a normal sized penis. So I do get why it's used like that. But pornography kind of like, it's kind of been used as education these days, whereas actually, you know, you wouldn't watch James Bond in terms of learning how to be a spy or learning how to drive, would you? So why are you watching porn? To learn how to have sex? It doesn't make sense at all.
No, I think you're entirely right. I guess the other thing as well is access, which is more serious, is access to pornography for younger people is far more traumatic than it was when we were young.
Yeah.
When, I don't know, I'd have like a friend had an older brother and he'd pass around a magazine, or you find something in the woods, or somebody who was gutsy enough.
Shout out to my cousin who gave me my first porn mag and then wouldn't give it to me to take home. He put it in the dog kennel, so I couldn't get hold of it because I was terrified of the dog.
So harsh.
So thanks for that.
That hasn't affected you in any way.
No way at all. No. I think I'm gay on my own.
Yeah.
It wasn't because missed out on the opportunity to read Razzle when I was 12.
I think that's a big worry for kids, isn't it? Because they can access things in such a way that we couldn't.
Also, I think there's a sort of linkage between like speed of internet access and your ability to see multiple screens, multiple different types of pornography. I mean, I'm not actually anti-pornography because I think for a lot of people it is educational because sex ed in the UK is not brilliant. And in other countries, it's even more restrictive. So that's helpful in some ways. It does teach them some of the stuff that they wouldn't necessarily ask their parents or their uncles or aunts, even if they're very close to them. You wouldn't necessarily, I certainly wouldn't have any sort of sexual conversation with any of my family. But then who else do you go and ask? I mean, lots of people don't feel like they can come to the doctor to ask, even though I would class a sexual problem the same as a blood pressure problem or a knee problem, same as you. Yeah. So I think I want to be asked. I want you to ask these questions that you think are really stupid or silly or whatever, and just ask, because you can't be certain some of the websites you're going on are going to give you the right information. I mean, I'm obsessed with sort of fashion and with like sunglasses and all this stuff, and I go down like massive Reddit deep holes about this stuff, and I'm thinking, if I'm doing this at this ridiculous level and I have certain views on the type of tint that I might have on a sunglass, let alone these gradients, etc. Imagine what someone who's worried about a sexual position or is going into, and what sort of depth of information they're getting to, and is it of any use?
Yeah.
Does it really matter? And I think that's the thing. Lots of this stuff, who cares? Just be grateful for the body you've got if you're able to be, and just enjoy it. Get naked,
I'm
enjoy
also
it.
Obsessed with fashion, as I'm sure you can tell.
Yeah, sure, Jan.
So apparently there was a study in 2015 that looked at thousands of men and showed that 15,000 showed that only 55% are actually satisfied with their penis size.
Yeah, there was a study in the US where they got guys to sort of put in their ideal penis size, and then they got women to put in their ideal penis size, and they found that they were an inch longer than the average penis size. So if we think about men, 70% of men have a penis that's between 4 and 6 inches in length. However, this idealized size is 6.5 to 7 inches in length, which means that pretty much 20% of people measure up. So it's causing this real distortion about men, about, what they should be packing. There's all this sort of stuff about big dick energy. When anyone walks into a room, you're kind of going, well, what if they've got a small wanger? There's lots and lots of stuff about cultural and racial things. I've got black patients coming going like, the expectation is huge. They want me to be either very physical with them, or they want me to have a big penis. I've got women coming to see me, and they're saying, actually, it's ridiculous. I'm expected to be this sexual animal. And it's really interesting talking about these cultural stereotypes that we've got now.
The other thing I think a lot of guys are worried about is time that they can last in sex.
Yeah.
And premature ejaculation is a big issue. So I thought we'd quickly cover that topic. Why do you think men are so concerned about PE?
Let's start with, so premature ejaculation is the most common sexual issue in the world. So approximately 30% of people have it. It's underreported, but we think about 30% of men have it. And why is it there? Well, it's genetic. It's meant to be there. We've been evolved to actually get rid of our genes as quickly as possible.
Sorry, when you say PE then, like premature ejaculation, how quickly do you mean
so
that?
Gone in 60 seconds. So the idea was that if you have, and it's peno-vaginal sex, so it's quite heteronormative, but if you have ejaculated within 60 seconds of penetration, that's considered early ejaculation. However, there are some people that ejaculate even earlier. So it's called anti-portas ejaculation. So anti being before, portas being the harbour, the vagina meant being the harbour. Wow. So if you arrive within the harbour before the 6 seconds, and often you've done it outside, that can be really problematic even for getting pregnant and things like that. We've got people that just sort of jizz in their pants, and it's just really distressing for them. Other people, however, premature ejaculation gets a bad rap because people ejaculate relatively quickly, they tend to be very focused on the foreplay, very focused on getting their partner off before they sort of hop in and ejaculate. And actually, if that's fine and that doesn't matter in your relationship, it's the bother or your fear or upset or worry that makes it a condition. Otherwise, it just is what it is.
Do you find that men are generally able to last longer just as they get older?
Definitely, the information going down to your genitals is basically a bit slower, and therefore you're less likely to come quickly. You're more likely to have delayed ejaculation as you get older. However, if you've always had lifelong premature ejaculation, it's probably because one of the serotonin mechanisms in your brain is set that way, so you get your genes away before the saber-toothed tiger takes out your hamstrings. It's a completely evolutionary thing. So it's destined to stay with us. It's just that we're sold a conversation that sex should last 20 minutes, half an hour, 2 hours or whatever. I'm just like, 2 hours? I've got stuff to do. Do you know what I mean? I've got my eBay list, my Vinted to put on. I've got to get exactly.
I've got to get those tinted glasses sorted out.
I do exactly. So I think it's this false thing. Like in porn, they are forever stopping and starting. They're using psychosexual techniques to stop the guys from ejaculating. They literally are squeeze technique, where you squeeze behind the head of the penis to kind of get rid of the sensation. They're stopping. They give themselves some time to recover. Also they've got like a film crew around them, which will to a degree reduce their drive to ejaculate. So they've got this false environment, which is kind of telling people stories that's really not helpful. But there's this brilliant study that, again, it's penis and vagina. They did this brilliant study where they timed heterosexual couples having sex. And so what you kind of do is click the clicker, stick your penis in, have sex, and then click the clicker again. So I appreciate it's not the most glamorous thing, but apparently it didn't make much difference to sex times. And the average in the UK...
We'll get back to Anand in one sec. Man Alive is a new show, and we have a huge amount of great celebrities and experts coming on to share with us both personal experiences and expert advice around men's health, as well as diving into real blood tests of guests. So please subscribe to ensure you don't miss any of them. And now, back to Anand.
It was about 5.4 minutes. Since then, we've managed to up our ante in the follow-up study to about 7 minutes, but it's still not dreadfully long, but also 7 minutes isn't the shortest period of time. You know how impatient you get waiting for a bus.
Yeah.
7 minutes is
it's a little off 2 hours though.
It's a little off 2 hours.
So
some of us stuff, they're just busy.
Are there any studies looking at non-heterosexual?
Not that much. Yeah, not that much, unfortunately. So it's very much the information we have from large studies with straight people. And also, if people are taking too long, you can do things. You can hyperstimulate people. You can put a prostate stimulator in and you kind of switch it onto high vibration power, which means you've got more vibration, more stimulation within the pelvis, which can kind of get you over the line a bit quicker. The other thing that some people do is they do some pelvic floor exercise, do some Kegels. We can do them together. So if you imagine...
We're really doing this.
We're going to do it now.
We're doing this.
Right. So imagine that you are holding on to your wee. So, we're in our 40s now. So we occasionally, run to the toilet. So the idea is hold on to your wee. So you're squeezing the muscles, in your taint again to stop yourself weeing, right? Squeeze, hold for 5 seconds and release. That's all you've got to do. So you've got to do that, say 15 times twice a day. And what that will do is it will build up your pelvic floor muscles. And building up your pelvic floor muscles, part of ejaculation is actually the pelvic floor moving up and down when you're squeezing out your juice. So basically ejaculation is propulsion. So to get that jet mechanism, your pelvic floor kind of wangs around like this. But if your muscles have been trained, they sort of move a bit more, the amplitude is higher, and that feeds back to your brain and goes, ooh, that was more fun. That felt a lot more fun. There was a lot more sensation in my genitals. So it feels like a much better time. So you can kind of not only control your ejaculation a bit more, but also you can sense it and have a bit more fun with it.
Okay. So I'm going to stop doing exercises now. That's
Allowed. Yeah.
If somebody's watching this and thinking, I'm a bit worried, I've got premature ejaculation, are there any sort of really simple, quick things we could say, yes, you could start doing that now?
Yeah, I mean, absolutely. Always the pelvic floor exercises. That's a simple start. You don't want to exhaust them, which is why I say only do those squeezes a couple of times a day because they can get knackered. The other thing that you might want to do is see a psychosexual therapist. They can train you in techniques such as the stop-start method or the squeeze technique. Also, there are spray-on things that you can use. So you basically spray your willy with a local anesthetic. You can get things called Stud 100, which are like a very fancy name for what basically is a local anesthetic. The problem is obviously you'll get a numb knob. So what you don't want to do is put a numb knob into a vagina or mouth or anus or whatever, because you'll numb their bit. And obviously, if they've got a numb bit and they can't feel it, or if it's painful, they won't know. So make sure you wrap it up, put a condom on it, and then have sex. And often actually it does increase the time to ejaculation significantly. Obviously the techniques I've talked about can increase it. And there are medications. I mean, people have found that if they take an anti-anxiety medicine or an antidepressant called an SSRI, it takes them longer. And that's because the serotonin that it's modulating in the brain is actively the chemical that allows you to ejaculate or not. So by modulating that, we can play around with it. So there are some treatments, licensed and otherwise, that we can use specifically to try and help people, particularly those people who've always had an issue. So they've had lifelong premature ejaculation. If they're what's called secondary, it's developed for a reason, it's trying to treat the underlying cause. So if, for example, it was trying to get control of their diabetes, sort out the testosterone, erectile problems, anything like that.
Yeah, that's great. I mean, that moves really nicely onto the next topic, actually, which is more around people that are having difficulty ejaculating at all, or maybe sexual function, so ED and erectile dysfunction, because antidepressants cause that as well, don't they?
Yeah, 50% of men, of people who take an SSRI, will have some form of sexual dysfunction.
Which I don't think we really counsel them for much, do we?
No, I mean
maybe we do, but not generally.
Exactly, yeah. I mean, it's well known to be an issue. The issue is that often people's mood is so poor that actually sacrificing their sexual function for a bit is what they might want to look at. But particularly, I certainly discuss it in people who are in relationships, who want to be in relationships, and certainly people who want fertility because it can cause issues in fertility, that this might cause an issue. There are other variants that might cause less sexual problems. So let's think about that. And it's just being aware of the ones that are less likely to cause sexual problems, less likely to cause DNA fragmentation, which can then cause fertility problems.
So they say about 50% of men will have some episode of erectile dysfunction at some point, which I was about to say is a massive problem. It's obviously not a massive problem. Thank you very much.
So Paul.
Thank you. But it's still it's a big issue.
Yeah.
So
I would say it's about 40% at 40 and 70% at 70. And if we're thinking about at 40, a lot of it will be psychological. Younger people will be psychological.
Yeah.
And that's often it's performance anxiety, because the brain is a wonderful thing, but to get an erection, you need two things. You need blood flow, which is what Viagra, etc. work on. The other thing you need, however, is nerve information. So if your brain's not turned on, if you are sad, if you are depressed, if you are worried about your mum who's sick or whatever, then unfortunately the information that's in your brain that's trying to get to your genitals just doesn't go. It's cut across. So if you cut that across, you're just not going to get anything happen. And that's often why I get people going, well, my Viagra didn't work. You're like, well, were you interested? Were you excited? Were you? And they were like, yeah, I was kind of excited, but I was knackered. I'd been drinking. I'd been trying to do that after a long day at work. And I'm like, well, just the nerve information is just not there for you. So, don't worry about it. But I still would give them things like Viagra or Cialis, because I kind of want to uncondition them from thinking they're never going to get a decent erection. Try and help them get the erection. They then try and solve the problem, the reason why they've got the erectile problem, what the psychological issue there might be. And then often it comes back on its own and they can stop the medication.
I think the opposite also occurs, where a lot of men will go, well, I don't want to take Viagra because I just don't want to walk around with an erection all day. And you're like, if you were that lucky, it was that good.
Can you imagine? Yeah. They're absolutely. I mean, they all worry they're going to walk out with hang a towel on it. They're like, oh no, it didn't work. You're like, but did you do anything? Well, no. Well, like, what were you doing? Well, like, I don't know. I was watching
Golden Girls.
Yes. Well, I mean, that's a fear. No, I mean, like if you're watching something, I don't know, so Cash in the Attic or something, somewhere you would definitely not be expecting to get an erection, and think that, I'm going to get absolute nonsense. As I said, you have to have the nerve input.
Yeah.
And unless finding, tat in your attic is getting you off, it's not going to do it.
It's a niche. Maybe we could set up a website or something.
I know plenty of websites.
What do you think is the most common cause then for ED?
So young people, anxiety, and issues going on. As it gets older, it's blood flow. So definitely it's going to be much more things like including blah, blah, blah. Much more likely to be things like raising cholesterol. So your cholesterol's bigger. If you imagine that basically your penis is a blood balloon, so you need a heart that pumps, you need blood vessels that are open, a blood pressure that's good enough, and then the tiny blood vessels in your willy have to be open enough to let all the blood in. And if you do, great, you get blood balloon. If not, however, it's a bit sort of floppy and sad. And that can be due to the blood flow. Imagine the pipes got furred up with all this cholesterol. It's just going to get narrower and narrower. Nothing's going to get through that sucker. So, we always recommend statins to some people as they get older, because actually if your furring up of the penis is happening here, it could be happening in your heart, it could be happening in your neck. So it's a really important precursor to be aware about. If you're getting relatively persistent erectile problems, definitely go and see your doctor, because they'll treat you like a heart patient until proven otherwise. You can't ignore it. It's even if you're 20, 30, 40, you should go and get it checked out, because we want to see you.
But that's different to the one-off guy who had an episode after he got hammered and couldn't.
Yeah, if he's got brewer's droop, he's got brewer's droop, doesn't mean 20 pints is definitely going to do that to someone. However, if it's, for example, if even when I'm on my own, I can't really get my erection as well as I'm with a partner, that's more likely to be probably a physiological erection problem. But yeah, there are things like having high blood pressure, having a clotting problem. You can have problems getting erection if your testosterone's low. Anxiety we've already talked about, depression. There's loads and loads of stuff that can cause it, which is why you want to go and see someone who will kind of check all of those things.
And not just give you Viagra.
Yeah.
So why do you think testosterone, or why does testosterone affect erections?
So testosterone is kind of like the oil that lubricates the system. It doesn't specifically give you the erection itself, but it basically powers desire, sexual interest. It kind of keeps your engine humming, and you're more responsive to sexual overtures. You'll pick up when someone's kind of giving you the eye. You're like, oh, that's interesting. And then it'll make you more.
Thanks. Carry on.
HR. But it's basically that. So testosterone does that for you, and it's less likely to give you the erections back, but it can really help in some people. But the thing it really helps with is the nighttime erections. I think lots of people think, I've got hard on at night. Brilliant. It's nothing about arousal. It's all to do with sort of dick housekeeping. It's about your brain kind of going, right, every 60 minutes, you kind of need to get an erection to flush it full of oxygen-rich blood. Because if it doesn't, the cells want to kill themselves. After 3 months of, say, not having a decent erection, say, for example, you've had a bad breakup, you've actually got a physical health problem, you have a prostate problem, whatever, of not getting a decent erection, your willy kind of goes, well, what's the point of me? And the cells actually start to kill themselves, and they end up scarred. So, and most people don't want a shorter, scarred penis.
No,
in general, I certainly don't. So yeah, it's about keeping it. It's use it or lose it again.
So if you said to a guy, I'm happy 30s, 40s, 50s, whatever, and he doesn't think he's got an erection problem, but if there was something we could do to him to say, right, these are things you could do to maintain a good erection, what would you suggest? So
diet, exercise, always, and sleep, really. So, sleep, try and get 7 to 8 hours a night. We know that if you have less than that or poor quality sleep, you release more of a hormone called cortisol, as well as other negative hormones. They reduce your testosterone, they increase belly fat, and they reduce your cardiovascular quality.
Yeah.
That cardiovascular quality. So it's important to get some decent sleep, eat, ideally a Mediterranean diet, lots of different fruit, nuts, seeds, and veg. If you want to do the Tim Spector, 30 different types of fruit and fiber a week, I would absolutely recommend that. It's really important for your gut microbiome. All of these, they did this study in America that if you use mouthwash, within a week, your blood pressure goes up by 10 units. Just in 1 week, because you kill off the bacteria in your mouth that start to break down food and release these chemicals called nitrates into the body just via your mouth, which drops your blood pressure. So these bacteria, viruses, funguses that live in our system, everyone's like, oh God, that's all disgusting. It's not. It's brilliant. It's so important at keeping our blood pressure low. We now know drugs like Tadalafil, Cialis, which it lasts longer in the body. If you take a low dose every day, it reduces your heart disease risk. So we're thinking that these drugs, rather than just being there to get you an erection, well, they improve blood flow. So, your whole body can do with a bit more blood flow. So it's making sure your diet's right, eating the right fats, good quality fats, reducing the amount of red meat, etc. you've got. I'm not saying don't have your Domino's or steak or whatever, but I'm saying 70% of your food should be unprocessed and ideally mostly vegetables, olive oil, etc. And then the thing is exercise. If you were exercising 3 to 5 times a week, ideally more weights, so probably about 4 to 1 weights or 3 to 2 weights, that would be absolutely great.
Yeah.
Large muscle exercise, building up, and obviously you've got very good arms because clearly you've been doing it.
Very kind.
I've noticed I've got puny arms. I've got puny arms. So it's about making sure you make those big muscles work for you. And actually they do improve your testosterone and they improve your sex life.
So it's kind of just, it's what we're saying is it's the same. It's all the common stuff we say for your heart, same stuff we say for your testosterone.
Yeah. And the reason we say it is for a reason. It's not like we're making it up. There's actual proof that it matters. But there are some supplements and stuff that can help you. Like they did a study with L-arginine and they had all these bodybuilders like taking this stuff and they were like, oh my God, this is amazing. And they didn't want to give it back. And they were like, look, why is this so good? Like, because actually I don't just get the pump in the gym. When I go home to my missus, I am literally raging.
Sorry, L-arginine for those who
So
don't.
L-arginine, it's an amino acid, and it's often used in lots of bodybuilding supplements. And what's really good about it is it's the precursor to a nitric oxide, which gives you an erection. So actually, if you've got lots of it winging around your system, I mean, you only need really 2 to 5 grams in a day. But if you've got loads of that in your system, you're going to get an erection more easily. So it's kind of what can we do ourselves, which is healthy and safe to use. So yeah, L-arginine's a good one. Eating watermelon is a good thing because you get citrulline from it, and that's the flesh. So that can be helpful. Beetroot juice again releases those nitrates, which gives you a better blood flow, so you can get a better erection. So there's loads of little things that you can do. Oh, nuts for your nuts. If you have proper nuts, not peanuts, but actual nuts, that's really helpful. Gives you the right mix of minerals and fats and protein, etc. And zinc is really good for your balls.
We'll get back to Anand very soon, but I wanted to ask you something first. Anand has spoken about some of the less spoken about issues that men face as they age. And I want you to comment below about any obstacles or challenges that you're anxious about. And we'll be hoping to cover them in upcoming episodes. Back to Anand.
Not yours specifically, but
no,
the balls in general.
Yeah, I'll still take that. I'm more concerned about my own. So I don't know if you've ever had citrulline and L-arginine as a supplement.
Had L-arginine, not citrulline. Not necessarily.
In years before, it's very common in pre-workout supplements, and it's the kind of stuff that makes your face feel like it's on fire. Very interesting side effect, and I think it must be this vasodilating effect.
Absolutely.
Because you feel like spiders are coming across your face. I don't take it anymore.
You can tell I've never taken it.
There's still time. So it's really interesting stuff. I think that's the whole point there, that all these sort of things we're saying, everyone wants a quick fix, and I hate this phrase, hack. I just can't stand it. It's like people that say, oh, I'm sick. So you're sick, you shouldn't be talking to me. This is the wrong use of that word, but that's not the point. Say hack.
Get that off your shoulder.
Thank you, yeah. People just want a quick way of improving their sexual function, and it doesn't work because all the stuff you're saying, eat better, sleep better, this is stuff you hear it time and time again, but it doesn't get clicks on social media.
No, but I mean, the thing, if you do want things to speed up a little bit, exercise, the pump after the gym really makes you more sexually interested. If you want to take a bit of magnesium before you go to bed, if you want to take some zinc, if you want to take some L-arginine, you probably will see changes relatively quickly within a week or two. So I appreciate it's not that magic pill, but equally a couple of weeks is fine with me.
Yeah. I'd still always try and do it through the nuts, through the...
Naturally.
That's a terrible use of the word.
Naturally.
Through the whole foods.
Yeah. Well, you want to do that for your life, right?
Exactly.
Life.
Yeah, totally agree. All right, that's really good. That does lead on really nicely to fertility, which is, I would say, you're the don of this area. Do you think that there really is a true issue around fertility?
Oh, totally. I think it's dreadful. I think we're looking at a really big problem. And everyone goes, oh, you're making such a big deal. I'm like, okay, let's look at this. So since 1970, men's sperm counts have dropped by 50%. So that's
is that just total number?
Total number. So sperm concentration. Say it was, this is number of sperm per milliliter. So it was 50, so it's 100 million in 1970, and it was then 48 million about 5 years ago. It's now even less, and it's declining even faster since the year 2000. So for some reason, this fall is speeding up. If at this current rate we carry on, we're going to be infertile in general in the West by 2045. That's 20 years away.
Sounds very...
Yeah, it sounds bloody
drastic.
terrible, doesn't it? Which is why we've been going to the House of Parliament to talk about it. Actually, we are suffering potentially a significant event in the UK. We've already got falling birth rates in the UK. There was just something out in The Guardian about how low birth rates in the UK. We have the lowest birth rates in Europe. Everyone used to be complaining about how easy, how quick people are to get pregnant in the UK, 14 and 15-year-old mothers. But actually, people are leaving it later and later. We've got very few pregnant people having kids in the UK, and that's a problem. It's going to create significant social change, change, significant economic issues, like who's going to pay for people's taxes and pensions? Where's that going to come from? And I know that sounds really dry and boring, but that's the end point of these things. You've got the one-child policy in China, which has led to a significant increase in the number of boys compared to girls. And now these men are looking for partners, and they can't find them. And these women have obviously got, well, I've got to have a higher standards now because I've got all these men that are looking for me. And so it's creating significant issues. So China's going to suffer, significant demographic changes, significant changes to its workforce. India's going to be very similar. So it's going to be interesting in the world in the next sort of 40 or 50 years.
Is it actually that the sperm counts dropping have any sort of clinical implication though? Because if you only need one sperm out of trillions.
You don't.
So
no, you don't. No, they're kind of like the sort of minimum fertile amount is 20 million per mil.
Right.
Okay. So you actually need a baseline of 20 million per milliliter of sperm you produce. And the average amount of a load is about 2 to 3 mils. Yeah. It's between 1.5 and 5 mils, but say 2 to 3 mils. So actually the average ejaculate contains 60 million sperm, 100 million sperm, whereas in the past they'd have had probably 500 million sperm.
But that does have a risk, an
massive risk, a huge implication, because if your testicles do two things, they make testosterone, they make sperm. It's a profoundly important environment that tells you what's going on with your body. If your testicles aren't making sperm, or they're not making testosterone, or both, it's a really good marker of how your general health is. There are now 27 different studies that have associated low sperm counts with cancer, heart disease, all these sort of longevity related issues. And we're finding them in young men. We're finding them in 20-year-olds where we should never have found problems with fertility issues. People used to think it's always the woman's problem in terms of fertility, but now 50% of cases are men because we've got so much falling testosterone levels and falling sperm counts. So we really need to act as a society to try and get this stuff better.
Okay.
Try and get this stuff better. Is
that no, I know what you mean. I'll cover a couple of things that might contribute to low sperm, and then we'll look at what is the real evidence behind it. But if you look at social media, obviously there's lots of triggers. So heat from having your phone in your pocket or laptops.
Totally true. So basically, if you've got any genital heat stress, so if you're wearing really tighty whities rather than sort of granddad boxers, you are going to increase the testicle heat. Your testicles hang out the body unattractively for a reason. The testicles make sperm best 3 degrees cooler than body temperature. So that's why they wang up and down a little bit. So if you're cold, they'll try and bring them up towards the body to heat them up a little bit. If you are sort of like in a tropical environment, they'll hang free. And actually, that's just very good for them. It cools them down. So important to keep your nether regions as cool as possible.
And it's normal to have one testicle larger than the other, isn't it?
Yes.
And hang differently than the other.
Exactly. So one's lower than the other, one's bigger than the other, completely normal. However, if you've got things that feel like a bag of veins, or so they kind of feel like a bag of worms at the back of your testicle, do get that checked out because it can be something called a varicocele, which is more present in infertile men.
Saunas?
Bad. Well, they can be fun sometimes, but they're not necessarily great. They're bad for heating up your testicles. The problem is that there's the stuff that's good for you in general life, and there's the stuff that's good for you in fertility.
Yeah.
And so saunas are great for you in general in the rest of your life, but they're not great for your fertile life because they heat up your testicles too much.
Yeah. Cold plunges.
Don't need to do them. You just basically, if you're really hot, just have a fan at the end of your desk and like wear a pair of shorts and just keep a bit of bluster around your balls.
I'm struggling in general to find a lot of true evidence around cold plunges, really.
Yeah, I mean, certainly there's something about vagal shock, but do you need to actually do that, or could you get the same response just from turning your shower cold?
Yeah. Microplastics.
Bad. So we definitely know now that microplastics, these are tiny little fragments of plastic that are coming off things like, even the stuff we use to wash our plates, or we're breathing it in from our carpets, or the cosmetics we put on our body, or aftershaves and fragrances we apply. That's not plastics, but these are chemicals that are getting into our bodies, and then they act as hormone disruptors. Some of them act as fake estrogens, so therefore they kind of feminize a male body, or they block hormones, and others are hormone blockers or hormone disruptors. They work in a kind of abnormal way, and that means that sperm development can be abnormal. What's really worrying is like if you've got developing body in a womb, so you've got a baby developing in there, and there are these hormone disruptors actually going into the body of that developing child, you can unfortunately cause significant problems. Imagine if the testicles of the fetus of the child that's yet to be born have already been damaged. What's going to happen to their fertility in the future? So I think there's a lot that's happened to us in the past. That's the reason why we are of lower fertility status than our grandparents were. I think our exposure to plastics in the environment over the past 50, 60 years has been huge. So I'm very much one to say, look, if you can heat your food up in a non-plastic environment, so maybe in glassware or pottery or something, that would be great. If you can avoid using sort of plastics to, particularly to heat food up in, but even to have, your water bottle. A water bottle, the reason it's squishy and plasticky is because those plasticizers that keep it soft and supple, unfortunately, also have hormone disrupting problems. And then you stick, some water in there and you store it there for a few months. It gets absorbed. So we want to try and avoid that as much as possible. Obviously, we do still want chemicals like fire retardants, because even fire retardants are hormone disrupting. But I don't want to burst into flames while I lay down on my sofa, right? So there's a balance to be struck between being safe and also trying to do the best you can for your fertility, your sexual function, and your hormonal function. I sound very doom and gloom. I'm normally quite positive.
No, I'm going to keep going with it. It's good. Ultra processed food.
A little bit's not bad for you, but if you are eating more than 30% ultra processed food, that is not good for your health.
Why does it affect your fertility?
So, all of these foods have been altered. So when I was younger, do you remember eating like French bread? And it would actually be really hard. Yeah. And actually it was really difficult to chew, and sometimes your teeth would hurt. These days, nothing is ever that difficult to eat. Occasionally a bit of celery or something, but who wants to eat celery? But if you're biting your way through food now, it's much softer. It's become much beigeur. It's much more pliable. It's got more mouth feel. And it's all because it's been designed that way. So it's easy to eat. It's easy to swallow. It means our taste receptors are going bing, bing, bing. This is super exciting. And it also means that actually you eat more than you would otherwise if you were having sort of basic unprocessed food that had been turned into a meal. Certainly the Van Tooligans did that study where, because they're twins, and one of them had mostly processed food, one had unprocessed food, and actually the volume that they were eating was significantly more when it was processed food. So I think clearly we want food that tastes nice, but the problem with that is we've got companies who are using our physiology against us, and causing us to eat more, which means we buy more stuff, we buy more of their product, but it's damaging our health. The chemicals that come out of that, so sometimes it's the packaging, sometimes it's the different mixture of additives that's within the food itself that then cause the changes that cause problems with fertility, but also cardiovascular disease, et cetera, et cetera.
Just to kind of summarize it, just in my own head a little bit then. So we're kind of saying it's more just the calorie intake of this stuff, because you can eat so much of it and the secondary obesity effect then affects your fertility?
Yeah, so it's the extra calories then causing obesity, then causing the secondary effect, but equally it's also the additives. So it's the mixture of the additives and the extra calories that causes the problem. And we don't know what all of these additives do for many years.
Yeah.
And until we're kind of going, suddenly banning all these things.
So you could effectively eat, I'm not going to do this, but you could eat an entire tub of butter.
Yeah.
That would still impact your fertility because you'd get a lot fatter, but it wouldn't be as bad as eating an ultra-processed butter.
Yeah, but margarine's terrible. They used to make coal butter, which was literally a spread, which was an extract of coal, the fuel.
Right.
So that's what it's basically oils. It's petrochemicals that we're putting in our body, thinking it's this health spread. I certainly was when I was younger. Margarine was meant to be way healthier than
Yeah.
It's complete nonsense. I appreciate you should not be eating the whole tub of butter because your cholesterol's going to go sky high. But actually, I now eat butter compared to margarine. I wouldn't really eat margarine ever at all.
Okay. I'm going to have to go home and throw in my margarine now.
Why do you eat margarine?
I don't know. I thought it was healthier for me.
Weirdo.
But it was like a sunflower one, so I thought it was better. But it's clearly not, is it?
No.
Great. Well, that's cost me some money. So if we had to summarize then, because I think it's a nice little thing in the section, you've got a guy again, and we say, what can we do to improve your fertility? Couple of quick tips. What would you want to do?
Try and get your sleep in. Exercise, but don't exercise too hard, because the more you exercise, the more you damage your fertility. So actually moderate exercise is absolutely fine.
Why?
So if you're wearing more Lycra, that heats you up. If your body senses too much stress, so high level exercise, particularly in ultramarathon runners and people who lift very heavy, your brain goes, you're not in any fit state to be fertile. You're living in a hostile environment, and you reduce the hormones that allow for fertility. So basically, they did a brilliant study where if you just jogged on a treadmill for 30 minutes, 3 times a week, all your parameters went up. If you have a Mediterranean diet, all your sperm parameters go up. So it's really about, you can completely change your testicular function. And because you make new sperm every 74 days, you've got this window of opportunity to completely change everything in 3 months. which is absolutely incredible. I mean, women are born with every egg they're ever going to have. They just have impact on ripening them, whereas guys can make a whole new batch. So if you can make a whole new batch, just focus in that period of time that you're trying to get pregnant, or not smoking, not drinking. We even know that drinking more than one cup of coffee a day causes DNA fragmentation in sperm. Smoking causes significant damage. So, definitely if you're able to, because I appreciate it's really difficult, get off the smokes and the vapes.
The coffee's still all right there, yeah?
No.
But a little bit of coffee's all right. I'm not trying to have kids anyway, so I don't care.
There we are. So no coffee, no tea, no no dark chocolate. Just for the period you're trying to, because obviously it's great for when you're not trying to have a baby, but I'm afraid it's not great for when you are.
I'll give you that. Fair enough. Okay. Actually, to be fair, I think, again, from clinic perspective, we've seen lots of guys who've got the physique or the appearance of being really, really healthy. Yeah. And then you do their bloods and you see either their total testosterone's low or their free testosterone's low, because you realize they are in this stress response state and you can't procreate if you, like you said before, you're going to get attacked by a tiger or you don't know where your next meal is. We talked before about masturbation being on the podcast.
Yes, we did. Yes,
we talked about before in terms of masturbation being healthy to reduce your prostate cancer risk.
Yeah.
Why? If listening to this episode with Anand is making you consider aspects of your own health, you can take the same blood test that the celebrities on our other episode take by going to the link in the description below.
So it was a correlation rather than a causation. So what that means is they took, it's several studies, not just one study. They've took these thousands of men over and they followed them over years. And the ones that got to a certain age, they sort of looked at the factors that were associated with living longer. And one of them was if you ejaculated more than 21 times a week, it was associated with you living longer.
A week or month?
A month. I say that all the time. Don't know. 21 times a week is quite heavy going.
I got to take some time off.
Thing is though, if you were 16, that would be absolutely fine. But like these days,
times an hour when I was 16.
Wow. Thank you for that information.
No one else involved. Carry on.
I have met you. So where were we? Got distracted by
21 times a month.
It feels like that song from So Solid Crew. 21 times a month basically clears out the pipes and apparently is meant to leave less toxins within the prostate, etc. So it's meant to be very helpful. But similarly, actually, if you're ejaculating frequently, the quality of the sperm is actually better because sperm kind of goes off after 4 or 5 days. So it's better to be having sex a couple of times a week. That'll clear out those tubes nicely.
Does a vasectomy then have any impact?
No, because your body just makes the sperm and then it reabsorbs it, kind of cannibalizes it and turns it into more sperm, which then kind of go in this useless loop. But it's fine. It doesn't make any difference. It's just as long as if you don't want to have a kid, it's a very effective way not to do it. But it doesn't cause any problem to your testosterone. It can be irreversible in some people.
So we spend so much time, I think, in the UK talking about why we're not screening for prostate cancer and how there should be better tests and better research, etc. But I don't think we spend any time really just telling people how to reduce their risk to start with. So if we said regular sexual activity, ideally 21 times a month if you can.
Yeah, and solo sex is fine.
Yeah, although we could provide certificates for patients if they need it. To show
it should be an app.
That's another business plan we could set up.
Very good. Masturbate.
What else would you suggest patients could do to try and reduce their long-term risk of prostate cancer?
It's really boring, isn't it? We keep going lifestyle, we go sleep, we go exercise. But it is that, do all of those things. Cycling excessively apparently may be associated with increased prostate inflammation. Getting yourself sexually checked out, because actually if you've got infections of the genital tract, which are allowed to sit there, they're going to increase your risk of infertility and problems down there. So I think that's definitely worth checking. If you've got a family history, absolutely increases your risk by 2.5 times if your dad had prostate cancer or if your mum had breast cancer. They both kind of increase your risk of prostate cancer. There's a few. Being overweight increases your risk of prostate cancer because there's more hormones that increase cell growth. Injecting stuff like growth hormone increases your cell turnover, so you're more likely to make mistakes. So I wouldn't advise that. Yeah, there's just a few things, aren't there, that you can do. So
I'd also heard around the risk of first-degree relatives with breast cancer.
Yeah.
So for these guys, should they be going to the doctor and saying, "Can I have a PSA test?" Or
so before people were kind of a bit sort of uncertain about PSA tests because we weren't certain that if you got a positive test, whether you'd get worked up by a false result where actually it's...
Can we just explain what PSA test is?
Yeah, sorry, very good. Yeah. PSA is a chemical produced by the prostate, and the more irritated the prostate is, the more PSA generally is produced. And it can be a marker for cancer. We say can be because it can go up without there being a cancer there. And that's the cases where you get very upset because you get worried about having cancer and then you don't have it. Well, obviously you're pleased you don't have it, but of the worry. But equally before, the tests that you used to have to try and find out whether you had cancer used to be quite invasive. They'd kind of have like your prostate harpooned through your bottom, which is not the dream. However, they've got a lot better with the testing. They've got now MRI scans, which specifically look at the prostate. So you don't have to do this sort of apple coring of someone's backside. You can kind of just have a look at it under the scan and know what's going on. So now it's a really good screening tool, just checking out if you've got it. I mean, we know that 1 in 8 men in the UK will have prostate cancer in their lifetimes. It's 1 in 4 if you're black. It's much lower if you're from the southeast, like I am, or from the far east. We think it's
of the world or England.
The world, yes. So if you're in London, it's all absolutely fine.
Yeah.
No, it's very well. Yeah, you're right. So it's South Indian, Africa. South Asia and the Far East Asia. You're far less likely to have prostate cancer.
Do you think PSA should just be an NHS screening now?
I think there should definitely be a screening program from 50 onwards because that's where the risk increases. If you're black or of black origin, then perhaps 45 or even lower if you've got a family history.
Yeah. So if you wanted to get your PSA tested, what would you suggest patients do now?
Go and have a chat with your doctor. I mean, I think it's really sensible to have that chat. You know, say if you're 30 and there's no family history and you feel absolutely fine, it's probably right not to do it. And that might be the end of the conversation. However, if you're 47, your dad had prostate cancer, your mum had breast cancer, you're a bit worried, go ahead and have a chat about it, maybe have the test anyway. If you're black and you're 45, 47, I'd probably have that test.
Do you think we could just cover briefly symptoms?
Yeah, absolutely.
Guys need to worry
the problem
about?
is that the symptoms of prostate cancer are often the symptoms of having a bigger prostate. Because as the prostate gets bigger, the prostate is kind of like an apple and it sits around the tube that you pee out of. And it starts off the size of a walnut and during life it gets gradually bigger. Now, it doesn't just get bigger externally, it gets bigger internally. So it squeezes the tube. So the tube sometimes gets a bit closed down, which means it's a bit more difficult to wee. So your stream's a bit slower. So when you're listening, it doesn't sound so much like a horse peeing. It sounds like a little tinkle into a pot. It is what it is, right? So you get slow stream. You also get people who find that they have a wee and then 3 minutes later they find there's a wet patch on their chinos. That's probably because there's a kink now that's developed and a bit of urine's kind of held back in that tube and it empties as you move away. There are other people that it gets so tight they get retention where they can't actually pass urine out at all, or they have to get up a lot in the night. It's called nocturia. So all of those things can be a problem. And so just if it's new, go and get yourself checked out.
Yeah. But it's not always cancer.
No, absolutely. But the idea is that if you get self-checked out, then they can tell you what the most likely cause is. They may pop a finger up your bottom to check how big your prostate is and also to see any lumps. But when they're checking for cancer these days, they mostly do the blood test itself.
I think there was a nice study from Prostate UK that showed that one of the biggest reasons men didn't go to get themselves checked was that fear of having a rectal exam. And I think if we can say to them, actually, you don't have to, PSA test is a great screen. And if that's negative and you feel fine, probably okay.
Yeah.
I know it's not a perfect test, but it's not bad.
But we just do have to get away from this thing about it's not masculine to have a finger up your butt. I mean, honestly, just get over yourselves. Your prostate has developed a significant number of nerve endings. And there are loads and loads of straight men that play with it, but just won't talk about it. In my head, it's ludicrous. It's just another part of your anatomy. And given the number of examinations women have to have, for example, throughout their lifetime, just do it.
Agreed. Although, in defence, there's also a social and cultural fear for a lot of guys.
Isn't it? And you're just like,
am I being violated? Is this something? Yeah. And I think men are not normalised to these sort of things in the way that women are necessarily because they have cervical smearing, etc. So I get it. They should be comfortable with it. I'm
very nice in clinic. I'm just being facetious today.
No, I know you're very nice in clinic. So, what about the use it or lose it principle for your penis? If you just stop having sex, I mean, it's not going to die off, but does it become
does, though? Yeah, after 3 to 6 months. It definitely does. I've definitely found people that we need to do penis rehab. So basically you kind of get them to use Viagra twice a week and get them to masturbate to hardness or with a partner. And actually that replenishment of oxygen-rich blood there really does restore the tissues, but it can take several months. So I would always say that even if you're in a depressive, I know it might be the last thing you're thinking about, just give yourself a hard-on. it's probably quite fun, actually. It might nice bit of your day. But if you get yourself an erection, at least you filled it full of blood. You don't have to do anything with it if you don't want to, but it might be fun to finish off if you do. But that will just keep things potting along. And equally, that makes sense in your 60s, 70s, 80s. I've had a 95-year-old come to see me, and actually he just wanted to have a little bit more pep in his penis. He doesn't have a partner, doesn't want to have a partner, just wants to be able to masturbate with a slightly harder knob. And I'm like, good for you.
I think that does also feed nicely into Tadalafil, or Cialis as it's also known, because obviously Tadalafil will improve erections, which you mentioned already, but it's also good for your prostate as well.
Yeah, absolutely. It's one of the few drugs that has a license for both erections and prostate. So the reason that you don't get erections quite so well is because of reduced blood flow, and because the muscles don't relax enough, and therefore the spaces aren't there to fill full of blood. Same thing happens with your prostate. Your prostate is a muscular tissue, which if it doesn't relax enough, it means the tube's going to be very tight in the middle. So if we can relax the prostate, the tube opens up and you wee a bit more. So by Tadalafil, you're kind of giving two cures in one. And also it reduces your risk of having a heart attack and stroke. So I am totally on board with
three things.
God, I could actually count. Yeah. No, I think it's a really good drug, and it's not trying to sell the company, because actually it's now off patent. I'm not supporting any drug company. I think it's a really good drug that we often put in the cupboard in terms of this is about embarrassing problems, and it's not. It's about treating something that is a really strong issue. I mean, erectile dysfunction is associated with economic loss. It's associated with poor relationship outcomes, with self-esteem issues, with depression, with anxiety. So actually, you give a man a hard on and actually think he'd be a pretty positive person.
Yeah, but it's something that guys just don't want to talk about. It's the last thing you mention on the way out, isn't it? It's not. Nobody goes to their doctors and goes, well, they do, but very few men will come and go, this is my primary reason for being here.
Yeah, and I get that it's embarrassing to talk about, and we've got a culture that doesn't talk about sex, so we need to kind of break that taboo. It's great that we're talking about it today, and hopefully this is a relaxed enough manner to say that, well, this is the conversation I'd kind of be having with you. There will be less, smirking, and slightly less childish, but actually at the same time, I want to have an adult conversation with you. It's not a conversation with me going, I am doctor, I must tell you what to do. It's like, well, what do you want to achieve? Do you want to last longer in bed? Do you want to have a harder erection? Do you want to know what your testosterone is? Or you've been very tired or something? What is it that you want out of this? And then we can try and work it together. Are you worried about the size of your penis? What is it that's causing you distress, and we'll try and do something together.
I think that's really good. I tend to go more in the kind of, you don't have to talk about this as a sexual function way, but this is a barometer of your health.
Totally.
And if you want to live longer, you make sure your erections work properly, because otherwise bad stuff's going to happen.
Yeah, exactly. There's that study with Montorsi where they found that they took 400 men who'd had a heart attack in Italy, and they found that 67% of them, so 2/3 of them, had had erectile dysfunction about 3 to 5 years before that. So it's definitely a marker of erectile problem, of heart problems. So if you do have an erection problem, please get checked out, because you might be, lengthening your life just doing it.
Okay. So supplements, which are something that I like and don't like in general, for healthy sexual function. What's your opinion on ginger?
So there's not masses of evidence, but it's mildly positive. So it's probably its antioxidant qualities that give you some help, so that the quality of the blood vessels remain as good for longer.
Fenugreek?
Similar. So I'm not really. I don't really know with fenugreek.
I couldn't find anything that says it does anything that.
It's nice and curry though.
Well, that could still have a good evening. I don't know. What about Kegels? You mentioned that before.
Yeah, pelvic floor exercises can also help you control your ejaculation. Can also give you a bit of erectile hardness. So if you want to squeeze to get it a bit harder, that works very well.
Brilliant. Ashwagandha's a big one at the minute. I keep hearing people on this.
Yeah, so definitely. So ashwagandha, tribulus, etc. They're meant to. Well, ashwagandha's meant to also reduce anxiety, but equally they're both kind of meant to be sort of pre-testosterone boosters, encourage your testicles to produce a bit more testosterone, and they do work. There is some commentary about whether you should only take ashwagandha in a kind of pulsed manner, so now and again, as in courses. But the evidence isn't massive either way. But so it does. It's not terrible, it seems. But again, I wouldn't be taking these if you're trying to get pregnant.
Yeah, totally. I'm also not massively keen from a testosterone side for the ashwagandha, purely because I don't know what's going to happen in 3 or 6. You could take it for 2-3 weeks, great. Yeah. And then does your body just get normalized to this and it goes back to what it was before, totally. But now you're having to pay for a supplement? I don't know. So yeah, I kind of agree. Any other supplements that you think are great for sexual function?
We've talked about L-arginine, because I think that's a cracker. Tablet-wise, obviously, Tadalafil and sildenafil, which is Viagra. Morning sex. definitely, because your testosterone's higher in the morning, so it might prime you, and also you're rested, so that's always a good time to have sex. Can't think of anything else. You put me on the spot.
No, but that's good because it means we've covered all the important stuff.
I hope so. Otherwise, it gets shut down.
All right. So I guess the final question is, if you could pick one thing as a soon-to-be middle-aged guy that they could do to start trying to improve their sexual function, and you're going to pick one, what are you going to pick?
Diet.
Oh, I was going to say exercise. Okay, fine. Why diet?
Because you can't out-exercise a bad diet.
Very good. Yeah.
So diet, I think for me, is number one. Exercise, sleep. They're all super important. But yeah, it's boring. I'm really sorry.
But that's the point, isn't it? And that's the thing, going back to what we said originally, that actually there are no hacks. There's no quick answer. It's just all the stuff we tell people time and time again. That's actually the most important thing to improve.
Totally. And also just, keep at it. Use it.
Keep at it.
Well, do you know, oh my God, everyone deserves a decent wank.
Yeah. Thanks. Cool. So talking about sexual function according to your age, and we mentioned this right at the beginning.
Yeah.
And you mentioned that there are certain amounts of sex you should have per decade of your life. Do you think you could sort of elaborate a bit on
so there was this sort of adage or whatever that people would be having sex 3 times a week in their 30s, twice a week in their 40s, once a week in their 50s and less going on. But actually we realize it's incredibly different for different people. And there are people that have been in long-term relationships in their 70s that are having sex every day because that's just part of their relationship.
Do you see, well, at least one of the things I see a lot from guys is the worry that they don't want to have sex as much as they used to. And it's like something must be wrong. Why do you think people lose that over time?
So I think partly is your testosterone drive that actually, as it reduces, you may not be that interested. But equally, I mean, after a certain amount of sex, how much more sex do you might not, is sex actually a thing about establishing seniority? Is it about power? Is it about, is it fun? Because, you can have sex for lots of reasons. For some people, it's about security. Some it's about compassion. Some it's about companionship. Sex can be a lot of things to people. And actually, if you've got a great relationship where you are companions and sex isn't necessarily the primary thing in your relationship, but you're happy, what does that then matter? It doesn't then mean you've got to go and find someone to actually have the sex with. You're just in that relationship and most people are satisfied with that.
Agree. Well, Anand, thank you so much for coming on. It's been amazing. Thanks for coming on Man Alive.
Lovely to be here.
If people want to follow you or learn more about you, where should they go?
They go. If I'm on Instagram at drana.nd, or you can find me online at dranand.com.
Brilliant. Thanks again.
Thanks for me.
Thanks so much for watching this episode of Man Alive. Although you might think this is an awkward episode to share with someone you know, it's packed with vital information. Who knows? They might even thank you. So share this episode with just one person and let's grow together. See you next time.